Good day, everyone. I'm Erica Supervenus, and I'm here to impart to you something about medical technology. So, what is medical technology? According to the Wikipedia, medical technology refers to the therapeutic or diagnostic application of science and technology for the better management of health conditions. Nowadays, researchers are focused more on producing new products, methods, and technologies for better healthcare. Now, these fast-growing trends make the lives of our healthcare providers a little more tiresome. Of course, they do need to study for the use of these devices, and as if the advancements ever stop. So, some of our currently used technologies are the smart intensive care units and the smart operation theaters. So, let's begin with the smart intensive care units. With the smart intensive care units, heart rate, blood pressure, and other vital signs are routinely assessed. Then, using a neural network operating system called fuzzy logic, the gathered data are interpreted, and this system judge whether there are any significant changes with regards to the patient's condition. And this helps the physician how? It helps him by lessening the approximations. Well, because most of the errors committed by the physician would be because of these approximations. Now, some of the numbers would be like only 0.01 difference or point something something. Now, those would be the beginning of the mistake. So those would be lessened, so we could be ensured of right medication and right dose. Next, for the smart operation theaters, the surgeon observes from 2 or 3 dimension image monitors, then he voices out the command, he voices out the procedure of the operation, then an automatic speech recognition system interprets the command and controls an integrated network of smart operation theater devices. An example of one is the robotic surgical system, which consists of 3 interactive robotic arms. Now, these robotic arms are the ones who are performing the operation. Now, this will help lessen the instances of cross-infection between the patient and the and the surgeon during operation. So, the use of these devices are quite frequent nowadays. It is said that 70% of all surgeries would be done in this manner. Now, these were first used with minor operations, but then they moved on. They were tried on to the major ones like gallstone removal, or then there's the pacemaker implantations, like those sorts of stuff. Now, also, there have been newfound ways of fighting cancer. These methods are the microwave therapy, proton beam therapy, multi-leaf collimators, and biochips. These fight cancer by helping to destroy the tumors and stopping the growth or the spread of cancer cells. Now, these are only some of the few advancements that are happening in the world of medical technology nowadays. Now, we could see how far man has come from the early microscopes to now electron microscopes, from the penicillin to these biochips. We could see how man has advanced. So, one could only wonder if doctors would ever be needed in the near future. we might be, well, who knows? We might be needing we might be needing our cell phones then, or a manual. Then everything will be all done independently. We wouldn't need to go to the hospital or to the clinic. Then doctors would be of no use, or nurses either. Well, that's just a thought. Well, who knows, right? Who knows? So, with that, thank you all for listening and good day.